what is your take on why there is a sudden increase in heart attacks among Indian people, and there has been a lot of awareness from a vascular angle? What will be your take on that?
We used to always imagine that this is more common with particular risk factors and all. And of course, risk factors are very important for us. But along with that, I believe there's a lot of inflammation, some degree of diet-induced inflammation that's going on. Unfortunately or fortunately, we are very carb-rich and also fried food-rich in this country. Almost 60% of or 70% of snacks we eat have fair amount of inflammatory food products in that, in the form of fried or refried oils and so on and so forth. So I think there is that challenge, and that needs to be probed further. The amount of Western literature we have on this sort of thing is not enough, I believe. And there is some other angle there. But also equally, I was very impressed when I actually read a paper in December about increase of heart attacks in Delhi during the pollution peak times. And this sort of validates what I've been thinking. Definitely that degree of AQI, that is bad pollution, that's literally prevalent everywhere. In places like Chennai and all, we don't see much because the sea breeze blows it over. You don't see that kind of a crazy pollution, but you do have a lot of pollution still. And that also causes more of cardiac events, I'm sure. And there is enough evidence now to say that, poor quality air that we breathe, high pollutants, do cause more inflammation and deaths. Because in many ways, the COVID opened our eyes towards this diffuse inflammation concept, right? It was a diffuse inflammatory disease, and so many heart attacks came because of that. So that sort of, if you extrapolate some of those concepts into this, definitely a lot of younger heart attacks that we're seeing have a strong correlation with the amount of food or the bad food we are eating, the bad pollution we're getting, along with other risk factors like, hypercholesterolemia, overweight, hypertension, diabetes, all that stuff, along with that, but this as well.
People think when we say vascular, they only think about mainly heart.
Correct.
Okay, educate the audience, what else vascular is?
So this is a very good question, sir. Basically, vascular heart is just a part of the vascular system. There is all the vessels that go to your brain. And in fact, now we have enough evidence to say that how we fix the heart as a first event, we should also fix the brain blockages as a primary. Brain angioplasty should be performed, right? Or clot removal should be done. So that's, anyway, this part of it, the brain part of it. Then we have vessels that supply your kidney, we supply blood vessels supply your legs, blood vessels that supply your liver, and all the other organs, hands, everything, right? So all those blockages, so the blockages of the heart, typically a cardiologist takes care. Blockages that go to the brain, typically neurointerventional doctor takes care. And the remaining blockages we all clump it into one area, and vascular interventional radiologists like me take care of that. And that's why we talk about blood vessels. So yes, you can get blockage of the legs, blockage of the kidney vessels, blockage of the arm vessels.
So every organ has a blood vessel supplying blood supply to it.
Correct.
And that can get compromised mainly because of a micro blood clots lining up the blood vessel.
Correct. So the blood vessels are lined by a thing called endothelium. It's a lining. And sometimes under that, there is cholesterol deposition. And that can either break, that causes sudden blockages, or it can progressively get more and more and more and cause chronic blockages. So, or a chronic blockage can become an acute blockage also. So all those things can happen.